Welcome to our channel, where we explore the fascinating world of biochemistry. My name is Dr. Morabais. I am a professor of biochemistry and molecular biology. Today, we're going to talk about inborn errors of amino acid metabolism. These are genetic disorders that affect the way our bodies process amino acids, the building blocks of proteins. From phenylketonuria to methylmalonic aciduria, we'll cover 8 disorders that every medical student should know. So, let's dive in. Let's take a look at 8 key disorders of amino acid metabolism. We'll cover the deficient enzyme, the metabolites that accumulate, and the signs and symptoms of each disorder. Number 1. Phenylketonuria, PKU. Phenylketonuria literally means the occurrence of phenylketones in urine. It is a disorder characterized by elevated blood levels of phenylalanine and the phenylketones. We will talk about the phenylketones later. There are 2 major classes of phenylketonuria, PKU, classical, non-classical. Classical PKU is caused by the deficiency of an enzyme known as phenylalanine hydroxylase. This enzyme normally converts phenylalanine to tyrosine. It requires tetrahydrobiopterin as a coenzyme. Non-classical PKU is caused by the deficiency of tetrahydrobiopterin, which could be caused by the deficiency of the enzyme which synthesizes it, or due to the deficiency of the enzyme that reduces dihydrobiopterin to tetrahydrobiopterin. What happens is that, whenever the enzymes that utilize tetrahydrobiopterin catalyze their reactions, tetrahydrobiopterin is oxidized to dihydrobiopterin. A reductase enzyme is therefore needed to convert dihydrobiopterin back to tetrahydrobiopterin. In both classical and non-classical PKU, phenylalanine cannot form tyrosine. Therefore, phenylalanine undergoes other pathways, which are usually minor under normal conditions. This includes transamination of phenylalanine to form phenylpyruvate. The phenylpyruvate is reduced to phenylactate. The phenylpyruvate can also be decarboxylated to form phenylacetate. The phenylacetate can combine with glutamine to form phenylacetylglutamine. The phenylalanine can also be decarboxylated to form phenylethylamine. Therefore, these metabolites together with phenylalanine accumulate in the body. Phenylpyruvate, phenylactate and phenylacetate are known as phenylketones. Hence, the name phenylketonuria. These include mental retardation, microcephaly, hypopigmentation, and a mousy odor. The mousy odor is caused by the elevated phenylketones in the body. The neutral amino acid transporter that transports phenylalanine, tyrosine and tryptophan to the brain cells is saturated with phenylalanine, leading to the deficiency of tyrosine and tryptophan in the brain. The mental retardation is majorly caused by the deficiency of tyrosine and tryptophan in the brain, leading to deficiency of dopamine and serotonin. The hypopigmentation is due to the fact that phenylalanine is a competitive inhibitor of tyrosinase, the enzyme that converts tyrosine to dopa and that uses dopa to form melanin. Elevated phenylalanine blocks this enzyme and prevents proper formation of melanin. How do we diagnose PKU? Renatal screening. PKU is an autosomal recessive disorder. Therefore, if both parents are carriers, a prenatal screening test can be done. Restriction fragment length polymorphism, RFLP. Southern blotting and PCR-based techniques can be used for the prenatal screening. Neonatal screening for PKU. Neonatal screening is done immediately the baby is born. This can be repeated 48 hours after the baby is born. Normal blood phenylalanine level is 1 mg per deciliter. Any level higher than 2 mg per deciliter indicates PKU. How do we manage classical PKU? Artificial diet low in phenylalanine and rich in tyrosine. Some fruits, vegetables and dairy contain higher proportion of tyrosine to phenylalanine and may help in managing this disorder. Note: tyrosine, an amino acid that is normally non-essential, becomes essential in classical PKU. Non-classical PKU. As mentioned earlier, non-classical PKU is caused by the deficiency of tetrahydrobiopterin, either due to the deficiency of the enzyme that produces it, or due to the deficiency of the dihydrobiopterin reductase. Tetrahydrobiopterin is a coenzyme for other important reactions. 1. Conversion of tyrosine to DOPA in the pathway for the formation of catecholamines. 2. Conversion of tryptophan to 5-hydroxytryptophan in the formation of serotonin. Therefore, a deficiency of tetrahydrobiopterin would lead to a deficiency of serotonin and dopamine, important chemicals crucial for brain formation and function. How do we treat non-classical PKU? We give artificial diet low in phenylalanine but sufficient in tyrosine, DOPA and 5-hydroxytryptophan. Alternatively, they can be administered tetrahydrobiopterin. Other important notes. 1. Maternal PKU. A phenylketonuria woman should observe the dietary restriction very strictly when planning to get pregnant and during the course of the pregnancy. Otherwise, the elevated blood phenylalanine from her body can lead to elevated phenylalanine in the baby, causing PKU signs and symptoms in the baby. 2. Aspartame. You might have seen some food labels indicating that the food contain aspartame, and phenylketonuria patients should therefore beware. Aspartame is a sweetener. It has phenylalanine as part of its molecular structure. In the body, it is broken down to release phenylalanine, aspartate and methanol. Aspartame increases the level of phenylalanine in blood. Therefore, aspartame-containing foods should not be consumed by phenylketonuria patients. Number 2. Alkaptonuria. Alkaptonuria literally means occurrence of alkaptone in urine. Alkaptonuria is another inborn error affecting the catabolism of phenylalanine and tyrosine. The deficient enzyme is known as homogentisate oxidase, or homogentisate 1,2-dioxygenase. This enzyme converts homogentisate to 4-malylacetoacetate in the pathway for the catabolism of phenylalanine and tyrosine. Because of this enzyme's deficiency, homogentisate, homogentisic acid, accumulates. The old name of homogentisate is alkaptone, hence, the name Alkaptonuria. The homogentisate that accumulates can be converted to benzoquinoacetate. Benzoquinoacetate can undergo polymerization to form melanin-like pigments which would eventually stain connective tissue. This condition is called ochronosis. Signs and symptoms of alkaptonuria. Alkaptonuria is not a very severe disease. There is no mental retardation. The major complaint is large joint arthritis due to the ochronosis. This usually starts in the second or third decade of life. However, you can suspect alkaptonuria if the urine of the babies turn dark. The alkaptone is oxidized on exposure to air, which makes the urine dark. The wet diapers are also usually darkened. Similarly, you will notice blue-black or brownish coloration of skin and cartilages, including the ear and sclera. Nitisinone reduces the level of homogentisate and may help to relieve the disorder. Management with painkillers may be useful. A diet low in phenylalanine and tyrosine would be beneficial as it would lower the amount of homogentisate produced in the body. Number 3. Albinism. Here, we are not going to discuss the details of albinism. We will only refer to the aspect that concerns amino acid metabolic defect, and that is the metabolism of tyrosine. Tyrosinase is the enzyme in the melanocytes that converts tyrosine to DOPA and uses DOPA to form melanin. It uses copper as a cofactor. It is different from tyrosine hydroxylase, which converts tyrosine to DOPA for catecholamine synthesis in the adrenal medulla and brain. Remember, tyrosine hydroxylase uses tetrahydrobiopterin as a coenzyme. There are different causes of albinism. If the albinism is caused by the deficiency of tyrosinase, it is known as tyrosinase-negative albinism. If it is caused by other reasons, it is called tyrosinase-positive albinism. Examples of tyrosinase-positive albinism are Hermansky-Pudlik syndrome and Rufus albinism. Albinos exhibit photophobia and are prone to skin ulcers and melanomas. They manifest nystagmus, rapid eye movements, and strabismus, eyes not tracking properly. They may manifest decreased visual acuity or even functional blindness. They must avoid too much exposure to the sun. Number 4. Maple Syrup Urine Disease. MSUD. Like the name suggests, the urine of patients with this disease smells like maple syrup, honey or burnt sugar. This disease affects the catabolism of the three branched chain amino acids, valine, leucine and isoleucine. These three amino acids are mostly catabolized in the skeletal muscle. After these amino acids are transaminated to their respective alpha-keto acids, the next thing is for those alpha-keto acids to undergo oxidative decarboxylation. The enzyme that normally catalyzes this reaction is known as branched-chain alpha-keto acid dehydrogenase. In maple syrup urine disease, this enzyme is deficient, leading to the buildup of these three amino acids and their corresponding alpha-keto acids. The buildup of these substances is toxic and can lead to serious health problems, including neurological damage and developmental delays if not treated early. Mind you, these three amino acids are essential, therefore, they must be present in the diet. For patients with MSUD, artificial diets that are low in these three branched chain amino acids are necessary. The deficient enzyme, branched-chain alpha-keto acid dehydrogenase, shows some similarity to two other enzymes, pyruvate dehydrogenase and alpha-ketoglutarate dehydrogenase. These three enzymes utilize 5 coenzymes for their catalytic activities. TPPFADNAD+. Coenzyme A, lipoic acid. Leukocytes are cultured skin fibroblasts from MSUD patients show little or no branched-chain alpha-keto acid dehydrogenase activity. There are different levels of severity. In the classic type, infants show symptoms within the first several days of life. If untreated, the disease leads to mental retardation, physical disabilities, and death. In the intermediate and intermittent forms, patients exhibit symptoms that are milder and show an onset from infancy to adulthood. There is a thiamine-responsive form, where patients are given thiamine at pharmacological doses to activate the branched-chain alpha-keto acid dehydrogenase. Dinitrophenylhydrazine test can be used to screen for this disease. The addition of 2,4-dinitrophenylhydrazine in HCl to urine gives a chalky white precipitate in the presence of these keto acids. Number 5. Homocystinuria. Homocystinuria is a disorder in which there is elevated homocysteine in blood and urine. Homocysteine is an intermediate in the pathway for the metabolism of methionine. The major cause of homocystinuria is the deficiency of cystathionine synthase, or cystathionine beta synthase. This enzyme converts homocysteine to cystathionine. It requires pyridoxal phosphate as a coenzyme. Therefore, vitamin B6 is required for this reaction step. This enzyme is deficient, homocysteine cannot form cystathionine. Therefore, it accumulates in the body. In this condition, cysteine, an important but nutritionally non-essential amino acid, becomes essential, since it cannot be obtained from methionine. It must therefore be obtained from the diet. Another possible cause of homocystinuria is the deficiency of the enzyme that converts homocysteine to methionine. This enzyme is known as methionine synthase. It is also known as homocysteine methyltransferase. It combines N5-methyltetrahydrofolate with homocysteine to form methionine and tetrahydrofolate. It uses methylcobalamin, a form of vitamin B12, as coenzyme. Maybe you have heard people say that vitamin B12 and folic acid work together. This is the reaction step where they work together. Deficiency of methionine synthase would lead to the elevation of homocysteine. Homocysteine is usually managed by administration of 3 vitamins: vitamins B6, pyridoxine, pyridoxal or pyridoxamine, vitamin B12, and folic acid, which is vitamin B9. Vitamin B6 is required by the enzyme cystathionine beta synthase. Vitamins B12 and B9 are required by the enzyme methionine synthase. Mind you, some people may also experience homocystinuria as a consequence of poor nutrition, i.e., having deficiencies of vitamin B12, B9 and B6. Patients that have homocystinuria exhibit ectopia lentis, displacement of the lens of the eye, skeletal abnormalities, premature arterial disease, osteoporosis, and mental retardation. Patients should minimize consumption of foods that are rich in methionine. Number 6. Cystathioninuria. Cystathioninuria is a disease caused by the deficiency of the enzyme cystathionase, also known as cystathionine lyase. The enzymes normally convert cystathionine to alpha-ketobutyrate and cysteine. It uses pyridoxal phosphate as coenzyme. Most individuals with cystathioninuria have no symptoms and the condition is discovered incidentally through urine or blood tests. However, some individuals may experience mild symptoms such as developmental delays, intellectual disability, seizures, and skeletal abnormalities. Patients should reduce the consumption of foods that are rich in methionine. The last two inborn errors we will consider have to do with the metabolism of propionyl-CoA. Propionyl-CoA is generated from the catabolism of methionine, isoleucine, valine and threonine. It is also generated during the catabolism of odd carbon fatty acids and during the conversion of cholesterol to bile acids. Number 7. Propionic acidemia. Deficiency of the enzyme propionyl-CoA carboxylase causes the accumulation of propionyl-CoA, leading to the formation of propionic acid. This enzyme requires biotin as a cofactor. Patients with propionic acidemia experience metabolic acidosis and organic aciduria. Symptoms can vary but commonly include feeding difficulties, vomiting, lethargy, and low muscle tone, especially in the neonatal period. If left untreated, propionic acidemia can lead to serious complications like seizures, coma, and even death. And in some cases, antibiotics to reduce propionate production by gut bacteria. Carnitine supplementation helps in the excretion of propionyl carnitine, effectively removing excess propionyl-CoA from the body. Number 8. Methylmalonic aciduria. This is caused by the deficiency of methylmalonyl-CoA mutase, the enzyme that converts L-methylmalonyl-CoA to succinyl-CoA. It can also be caused by the deficiency of vitamin B12. In either case, L-methylmalonyl-CoA, D-methylmalonyl-CoA and propionyl-CoA accumulate in the body and are converted to their acid forms: L-methylmalonic acid, D-methylmalonic acid and propionic acid. These acids enter the nervous tissue to cause neurological disorders. There is also metabolic acidosis and organic aciduria. Methylmalonic aciduria, MMA, treatment involves a combination of dietary adjustments, medication, and in some cases, organ transplantation. Note: deficiency of methylmalonyl-CoA mutase leads to the accumulation of methylmalonic acid, MMA, in blood and tissues. Vitamin B12 deficiency also causes the elevation of methylmalonic acid levels in blood and tissues. A low-protein diet, supplemented with specific amino acids and vitamins, is crucial. Medications like carnitine and cobalamin, vitamin B12, are often used, and antibiotics may help reduce the production of propionyl-CoA in the gut. In conclusion, for medical students preparing for biochemistry exams, here are the high-yield areas to focus on. 1. Key enzymes and their deficiencies. 2. Accumulating metabolites and their effects on the body. 3. Signs and symptoms of each disorder. 4. Diagnostic tests and treatment options. Remember, these disorders are relatively rare, but understanding their mechanisms and clinical presentations can help you excel in your biochemistry exams and become a better clinician. That's it for today's video on inborn errors of amino acid metabolism. We hope you found this comprehensive overview helpful and informative. Don't forget to like, share, and subscribe for more biochemistry content. Thanks for watching, and we'll see you in the next video. If you have found this video useful, kindly like, comment and share so that your colleagues can have access to it. Don't forget to subscribe to the channel in order to get notifications for new videos. Bye.